Personal hygiene. In this module, you will learn the importance of good personal hygiene and proper hand washing for food safety, techniques for effective hand washing, appropriate clothing and attire for food handling, symptoms and steps to take when food handling employees may be ill. Having good personal hygiene habits is one of the most important things you and your coworkers can do to prevent contamination and foodborne illness. With regard to personal hygiene, there are several areas that require close attention. Hair. Your hair should be clean and pulled back or restrained using a quality hair restraint. Clean shaven. Facial hair can attract numerous bacteria and germs. It is a good idea to be clean shaven at all times when working with foods. Work attire. Your clothes should be clean. Wearing long sleeves is also a good idea. You should always wear a clean apron and change it whenever moving from raw foods to ready to eat foods. Little or no jewelry. Contaminants can collect on and around jewelry items such as rings and bracelets. Fingernails. Your fingernails can cause multiple types of problems. Long nails can chip or break and fall into food. If you wear nail polish, it can also flake off into food items. Bacteria and dirt can also get stuck under longer nails, so it is good as an idea to keep your nails short and clean. Hand washing. In the last scene, we showed several different personal hygiene issues that can cause contamination. However, the single most important part of any good personal hygiene is washing your hands. In fact, the simple process of washing your hands is so important that we will cover the proper techniques of hand washing in the next few scenes. These guidelines are very important, so please pay close attention to the following information. In a given day, our hands may be exposed to millions of bacterial, viral, fungal, and even parasitic growths from doorknobs, zincs, computer keyboards, pets, children, co-workers, and from our own bodies. Because we use our hands for almost every task in our daily lives, we may not remember to think about the potential transfer of germs that our hands can facilitate. Hand washing. Employees should perform hand washing only at designated hand washing sinks. Sinks used for washing dishes or for food preparation are not appropriate hand washing sinks. Many food establishments have a specific hand washing sink within each area of food preparation and cooking. This helps prevent the need for touching door handles after cleansing. You should wash your hands when entering the kitchen, even if you already washed them in the restroom. Employees should wash their hands only at the designated hand washing sinks, and the sinks should have the following in place: hand cleaning liquid, individual disposable towels or an air dry device to dry hands, a waste receptacle, a hand washing sign notifying employees to wash their hands. Proper hand washing steps. Only the proper procedure for hand washing, following a specific order of steps and lasting for a certain duration, is acceptable for sufficiently cleansing the hands and forearms, including any surrogate prosthetic devices. The steps of hand washing are as follows. Step 1. Rinse. Rinse hands and the exposed portions of the arm up to the elbow under clean, running, warm water. Step 2. Soap. Apply an appropriate amount of an approved cleaning compound or soap. Step 3. Lather. Rub the soap into a lather over the entire area to be cleansed for at least 20 seconds. The scrubbing motion is very important as the friction is needed to dislodge any bacterial growth. Be sure to concentrate on bacteria-prone areas such as the fingertips, beneath nails, and in between fingers. A nail brush may be provided at the hand washing sink for more thorough cleansing beneath the nails. Step 4. Rinse again. Rinse lathered areas thoroughly under clean, running, warm water. Step 5. Dry. Use an appropriate method for drying immediately after cleansing. Appropriate methods for hand drying include using disposable paper towels, a heated air dryer, or an air knife drying system. Multiple-use towels or articles of clothing are not appropriate drying materials. Proper hand washing summary. After cleansing, an employee must be sure not to touch any potentially contaminated object such as the faucet handles or a door handle. If touching a handle is necessary to turn off the water or to leave the area, the employee should use a disposable paper towel to avoid direct contact with the handle. Automatic devices, of course, prevent the need for this contact. Using hand antiseptics. Antiseptics are not a substitute for proper hand washing, and a non-soap antiseptic should be used only after proper hand washing. If hand dips are used as proper wash antiseptics, they must be kept clean and must be maintained at a strength of at least 100 milligrams per liter of chlorine. When to wash your hands. Arrival at work, after restroom visits, after handling kitchen equipment or utensils, after touching dirty plates or dishwasher, after leaving the kitchen area for any reason, after emptying trash bins, after cleaning any equipment or using any cleaning products, immediately before preparing any food, after touching any part of your body, after handling any raw foods. When washing your hands, you must use a sink designated for hand washing only. Gloves. Gloves provide added protection against infection and contamination between the employee's hand and the food. You should change your gloves regularly and in each situation below. After handling any raw meat or high protein foods, if the gloves are torn or damaged, before contacting any ready to eat food item. Eating and drinking in food preparation areas. Food handling employees are only allowed to eat, drink, or use tobacco products in designated areas. A food employee may drink from a closed beverage container if the container is handled to prevent contamination of the employee's hands, the container, exposed food, clean equipment, utensils, linens, and unwrapped single-service and single-use articles. Hair restraints. Keep hair from contacting food, clean equipment, utensils, and linens. Handling animals. Food employees may not care for or handle animals that may be present, such as patrol dogs, service animals, or pets. Food employees with assistance animals may handle or care for their assistance animals, and food employees may handle or care for fish in aquariums or molluscan shellfish or crustacea in display tanks if they wash their hands in the manner described earlier in the course. Jewelry prohibitions. While preparing food, food employees may not wear jewelry, including medical information jewelry, on their arms and hands. This does not apply to a plain ring such as a wedding band. Clothing and attire. Wearing clean clothing helps prevent the infection and physical contamination of foods. Bacteria or physical particles on an article of clothing can be easily transferred to food. Food employees shall wear clean outer clothing to prevent contamination of food, equipment, utensils, linens, and single-service and single-use articles. Apron. Your apron should always be clean. Change your apron if it becomes soiled. Change your apron when moving from raw to ready-to-eat foods. Long sleeves. Long sleeves provide a barrier between your skin and any food items. Shoes. Always wear comfortable, slip-resistant shoes. Fingernails. Fingernails should be short with smooth edges and unpolished. Nail polish and artificial nails are allowed only if the employee wears intact gloves at all times while handling food. Appropriate cleaning procedures of fingernails were discussed previously in the hand washing procedures section. You can refer back to it at any time. Foodborne illness symptoms. Diarrhea, vomiting, sore throat with fever, cramping, dehydration, exhaustion, lesions or sores that contain pus, jaundice. Foodborne illness symptoms. Notify your employer immediately. In some situations, these symptoms may appear very quickly. Normally, they will appear within 24 to 48 hours, depending on the severity of the contamination and how much contaminated food you consumed. While most foodborne illnesses are not life-threatening, high-risk groups are more susceptible to dangerous reactions. The Big Six illnesses. There are over 40 different kinds of bacteria, viruses, parasites, and molds that can occur in food and cause a foodborne illness. Of these, six have been singled out. These have been dubbed the Big Six because they are highly contagious and can cause severe illness. There are six major illnesses that employees are required to report to their manager or supervisor immediately. These illnesses will require restriction or exclusion from food preparation and or handling duties. Likewise, managers are required to report the occurrence of an employee with jaundice or with any of the diagnosed illnesses listed here to the local regulatory agency. The Big Six illnesses are norovirus. Norovirus symptoms include vomiting, nausea, fever, and aches. This illness is usually transmitted by an infected person handling food items. Hepatitis A. Hepatitis A is an illness that affects the liver. It is very dangerous if left untreated. Symptoms include headache, fever, and jaundice, yellowing of the eyes and skin. Salmonella typhi. Salmonella typhi is a type of typhoid fever. It is highly contagious, and you are required to report any diagnosis during the last 90 days to your employer. Non-typhoidal salmonella. The symptoms of non-typhoidal salmonella include nausea, vomiting, abdominal cramps, diarrhea, fever, and headache. Shigella, SPP. Shigella causes extreme stomach intestinal illness and is usually caused by improper hand washing techniques. E. coli, commonly called E. coli. This illness can be harmless, but some strains are quite dangerous. Causes include improper hand washing and improper food storage. Employee illness reporting. If you have been diagnosed with any of these illnesses, you are required by law to notify a food manager at your establishment. There are many other foodborne illnesses that are highly contagious, so make sure and check your manager with any illness or open sore you have before coming to work. Diarrhea, vomiting, sore throat with fever, cramping, dehydration, exhaustion, lesions or sores that cause pus, jaundice. If you have any of the symptoms described above, your manager will instruct you not to return to work until further notice. Discharges. Food employees experiencing persistent sneezing, coughing, or a runny nose that causes discharges from the eyes, nose, or mouth may not work with exposed food, clean equipment, utensils and linens, or unwrapped single-service or single-use articles. Injuries. For employees with a pus-filled skin lesion or an open or infected wound, the lesion or wound must be properly covered for the employee to be permitted to work as a food employee. If these standards are not met, the employee must be restricted from acting as a food employee. Employees are also required to report any lesions or open wounds to the person in charge prior to their exposure to food. For lesions or wounds on the hand or wrist, the affected region must be covered with an impermeable cover such as a finger cot or stall. Single-use gloves must be worn at all times as an added precaution. Your arm. For lesions or wounds on exposed portions of the arms, an impermeable bandage must cover the area at all times. Non-exposed areas. For lesions or wounds on non-exposed areas, the region must be covered by a dry, durable, and tight-fitting bandage.